everyone, and welcome to the Health Tech Edge, where we talk about the latest topics in healthcare technology with industry experts. I'm your guest host, Mike Moore. Joining us today is our weekly panelist, Raheel Reddywala. He's the Chief Strategy Officer at Productive Edge. And our featured guest today is Safi Mansoor, Program Manager and Lead for the Data and Analytics team at UMass Memorial Medical Center. Welcome, Safi and Raheel.
Glad to be here.
Being here.
So there's a lot of things that are happening in the world of data and analytics. There are a lot of things that are happening in the world of healthcare. Today, we're going to get into really what happens kind of day in the life of a team that's right in the center of this. Maybe, Safi, we start off with just a bit of background about you and the team that you work with, and maybe a little bit about UMass Memorial for those who aren't familiar with that health system.
Sure. UMass Memorial is one of the leading healthcare organizations in central Massachusetts. It's one of the biggest. We are close to 16,000 employee hospital, which is fairly big in our thing. So starting 2017, October 2017, we embarked on the journey to implement Epic, which is the leading EMR that at least a lot of healthcare hospital organizations use. We were on Cerner. That experiment did not go well, so we moved to Epic, and we've been fairly happy with that since then. It's not the best, but given what we have, I think it's fairly good. In terms of our team itself, for the analytics in the group, we are around 15 to 18 people. We constantly get consultants in and out. That's what we have for team. During Go Live, our team was almost up to 25, where we had a lot of consultants come and help us out and all that. But since then, we've stabilized, and we're around 15 to 18 people in our group.
So you've got kind of an ecosystem with Epic, right? Like you're kind of in the application, you've got a proprietary database and data structure and all of that. Tell us about some of the requests that you work on from the business or kind of regular reports that you send out.
Great. Yeah. So one of our biggest day-to-day, that's our challenge is, and which we would love to move away from, is requests that we get from our users, our end users, our nurse managers, or financial analysts who need data to send out and things like that. We are not in a place where we can say, here are the self-service tools we have. We've provided them a lot, but still it's not in a place where our core users, end users, are familiar with them in a way where, yep, we don't need to bother them. We have the tools. We're not in the nirvana stage yet. And I can talk a lot about what we can do to come to that stage. Most of the time, we are basically in a reactive mode. What does that mean? I mean, constantly getting requests. I mean, the biggest thing we had a call this morning is we have tickets that have mounted up to 300 tickets right now, and we are waiting on that. Why is it? Some of these requests are fairly big, and they take a lot of time, to get those requirements answered and requests sent back. So that is a reactive mode. We need the resources and a resolve from the group and the leadership to say, you know what, let's focus. Let's have this team do the reactive work. Let's build a team that's proactive. What do we do there? Build the tools that are necessary so we don't even get those requests. We have the tools where it's all right there for our end users. They can go there, self-service. So not just we have a team that does all this proactive work. We need a lot of training folks to train the people who will be using these self-service tools. That's our biggest challenge. So getting the resources to stay on, and it's not that we can get people from the street and have them up and running. It's there's almost a 6 to 7 month ramp up period for somebody to come in and get productive on our systems.
So Safi, very good insight, and really, really good to hear the sort of how what things are like at the where the rubber meets the road, if you may. I guess the one of the things that we see is that a lot of organizations are in a journey, right? So you mentioned 2017, UMass Memorial implemented the EMR, which is Epic. as that comes on board, right, there's a significant change management that has to occur from the care providers and physicians and everybody that touches patients to change how care is delivered. On top of that, you've got significant significant pressures from perspective around things like value-based care, quality metrics that have to be kind of thought through, the state of work during COVID and the impact that had and the healthcare workforce. So there's a lot of different competing sort of factors that drive and have driven over the last few years the balancing between how we can innovate, how do we take the next steps from digitization of the electronic record, and how do we use that effectively to drive some of the more strategic objectives. I think that's where you are. It seems like where you're in many ways at those crossroads where you're saying, okay, well, we've kind of internalized the use of the EMR now. We are now looking at an opportunity to kind of extend that and think broadly about how best to utilize the investments we've made in there. And more importantly, as I agree with you, that data and analytics play a significant role in driving the next phase of innovation on top of the investments organizations made in EMR. So I'm curious to hear from you a little bit about, if you think about innovation and proactiveness, what would some of those use cases be?
One of the big thing would be like develop these tools that can make us proactive. What do I mean by that? So you have our EMR. The Epic EMR is kind of standard. So across each organization, we follow a standard upgrade cycle and all that. So that's pretty unique and uniform across all hospitals. So in terms of innovation, what we could do is, the requests that come from our end users, they're fairly common across hospitals. I speak with a lot of other hospitals, and they say, okay, and then when I hear from what they have to say, it's like, okay, then the thing I get out of that is, all right, we have the same problems, we have the same things. So the biggest thing is, what can we do to become proactive? So when we are proactive and we don't have this 300 tickets sitting on our backs, we get a time to be more proactive and doing innovative things. So COVID came. It came out of the blue, and what did that do? Our ticket backlog just like ramped up like there's no tomorrow. So it just ballooned up. Why was that? Now, because if we had proper tools and end users were given those tools, so we wouldn't have had those tickets coming in, and we could have focused more on the COVID. Now we had a big balancing act, so we had to take care of the tickets that were coming in, and also had to work on this COVID initiatives and things that were needed for COVID.
Right.
So that's the big thing. So if we can, come up with a solution where, these regular tickets that come in, what can we do to basically, remove that backlog, at least reduce that big time.
Right. Can you
That would be a huge thing in terms of
I'm very curious. I'm sure Mike's as well. If you were to zoom out and say some categories and bucket those tickets into some meaningful bucket areas, right? What are those things that people are looking for today that cause you to be in a more reactive mode? And what are the things that you could foresee seeing coming? For example, if you're talking nurse managers, like what information are they really looking for that's hard to do or hard to get, or just takes time and manual intervention to get done? Or if you look at financial analytics, you look at value-based care, if you look at quality metrics, just curious, what are the spectrum of needs that you see that drive the sort of a reactiveness?
A lot of times, I'd say half of 50% of the time, those requests that come in, there's already something out there. It's just that either the nurse or whoever the requester is, they don't have enough information to go grab that information. So a big portion of what's required is training. A big training staff is required. And these people, and again, remember, these nurse managers or, the healthcare professionals, their core capability is not looking at data or numbers. Their core capability is patient care. Now, if they are being tasked with, all right, look at this data and try to come up with something, I'm like, they're lost. Are they going to look at patient care, or are they going to try to figure out this, data and report or whatever?
Right.
So,
right.
Yeah.
Well,
so
and that's the thing, like triage is not an unfamiliar term in healthcare, right? Like it's
Correct.
very core to what happens in healthcare. And it's almost that triage function that you need to evaluate those requests as they come in and figure out. And this is, kind of managing software. In the past, I think about, you get a request from a client for a feature customization, and it's like, is this something that would benefit the one customer or many customers? And then that kind of decides, is it a one-off, or is it something that we put into a roadmap for that team, and then kind of take it from there. So I imagine you must have that kind of that triage process.
Correct. So we like literally last year we did actually exactly in the same way. We created a data concierge team. So what does this do? It's basically the first line of all the tickets that come in. They look at the ticket, where it needs to be routed and all that. And most of the time they take it upon them, like if it's, a straight cut, we need a report or blah, blah, blah. So they look at, why is this report being asked? I mean, do we have a report? Or they dig a little deeper rather than just looking at what the request is and just forward it. Why is this ticket coming in? We have a report for this. We have, because like 90% of the time there is actually a report for that. It needs to be modified in terms of what fields are added for that within that report and all that. It is customizable, so again, training is needed. So what they do is most of the time they direct the requester to a training staff, depending on how soon they need it, how often it's needed. If it's needed a lot, we provide the training at hand, where the trainer goes to their group or to that person and say, wanted to help you. So this looks to be a fairly common request from you or your group. What can we do to help you, to train you or your group so that your self-service and all that. So at that time, so what that does is, it does not take a lot of time and effort for that nurse manager or whatever. They know exactly what needs to be done, and they can go back to focusing on patient care. So we've started with that data concierge. It's been a very successful thing so far, and
that's awesome. Safi, I mean, when you look at let's switch the conversation a little bit to how can we become more proactive, right? And one of the things, of course, is the data infrastructure, the data estate, and the strategy for driving the automation and analytics or delivery of the insights at the right moments to the right people. It requires another, as you said, level of thinking and investments in tools and tooling and training, etc. I'm curious. You've got Epic currently. How are you thinking about, like, what's the next phase for enabling that? If you had all the resources in the world, how would you accomplish sort of this shifting to a more proactive model?
The thing is, what we would do is to more proactive models, we would provide tools. We would have, like, some of these common requests. We would provide published data sources, like the logic solved behind the scenes. It's done, but what's distributed to the end users, or the logic. We give them a metadata layer. Mm-hmm. So they just look at that and they drag and drop the fields into their report, and a report gets generated. The joins between those tables, all that's done behind the scenes, through multiple tools we have. We have stored procedures written behind the scenes, and that's executed to present that and all that. So that's one of the thing. There's another thing that just came to my mind and it skipped. So that's one thing we can do. And a lot of we are promoting the concept of having published data sources, so they can use their tool of choice at that point. They could use Tableau or Click or Power BI and things like that. So they can just drag that, take that, and use that. Yeah. I'm not sure if I answered that.
Yeah, no. I mean, absolutely. Right. So you're talking about publishing data sets. Of course. Just making sure that people don't have to get into the nitty-gritty of the underlying relationships of data. Correct. But partly that's what, when you talk about investments that, data models, pre-built healthcare data models are trying to do, right? So whether you look at population health analytics or you look at financial analytics, or if you look at, extensions to Firebase data models that organizations are doing, do you see a time where an organization your size can say, let's move to a standard data model that allows and enables out-of-the-box analytics? And then, of course, fundamentally what they're doing is giving you these published data sets, and you're just arming people with, the data visualization tools and APIs that can, really consume those insights and deliver those as part of experiences that may be there. Have you considered some of those and looked into some of those data models?
That is our nirvana state. So we're constantly, like, we have a team that's basically building all these, data models and all that. We have a data warehouse team that's building all that. And Epic's come up with a way, it's called Slicer Dicer, where, there's a lot of functionality behind the scenes, but what the users see is simple drag and drop things. So that work is in progress. And another thing, I just remembered what I was looking to say at that time is, so we have, I'm going to give you an example, a lot of different groups, all right? Now, I'm going to give you an example. So they want to show, different groups have to, within their group, show productivity, like physician productivity. Each one has their own way of doing it. I mean, that's such a waste of time. That's such a waste of time. That's just a simple example I get. There are so many different things. Patient care differs from group to group, and for example. But from the financial perspective, the physician productivity should be fairly standard.
Right.
Most of it comes from Epic. Why is administrators within different groups going around building their own little dashboards? That's such a time sink. So we are looking to, so basically there needs to be a leadership at the high level that oversees all these departments or organizations. Say, for this metric, for physician productivity, we will follow a standard report, standard data set, or whatever it is. At that point, we can build that standard data set. We can definitely take into account some anomalies, like radiology has different sources. So yes, we can definitely take into it. But for everyone else who just takes it from Epic, why don't we use a standard source? Why don't we use a standard way of depicting them? The graphs should be similar look and feel. That prevents so much of time sink from the analytics team, from the people who are the administrators of each of these groups. I mean, I'm literally actually working on an effort like that, where we're trying to promote that. Why don't we come to a consensus that let all these groups have the same kind of productivity numbers or features, so it'll be one.
You can take inspiration from other industries, right? Like Raheel, I think about other industries that are, whether it's like a lot of software and tech companies, they have a set of KPIs that organizationally everybody signs up for. There's a cascade through the organization, and then there's the presentation of the data, right? That gives people that scorecard that helps them drive to those results that organizationally we've set out to do. And a lot of it, especially in healthcare today, is so cost and efficiency and patient outcomes and all the kind of things that you're trying to drive without driving that organizational alignment and getting everybody on the same page, and then embracing the differences, right? Like you said, if radiology happens to be doing some different things, or this department or that department. I saw a video on LinkedIn this morning with your head of cardiovascular, I think, talking about Apple Watches and Fitbits and tracking atrial fibrillation. Like, you've got some very advanced kind of things that are happening, and all kinds of tools and diagnostic equipment, both things in the hospital and outside. Wouldn't it be nice to tie all that stuff together and be able to pull it in, right? Like, I'm sure that's your dream of what you think about, but it's like you said, everybody's kind of coming out post-COVID and looking for those opportunities and quick wins. So a lot of opportunity to prioritize, but still having to work with some limited resources.
Absolutely. Yep. So resource is the biggest thing. I mean, resources in terms of, and a resolve to say, let's not try to reinvent the wheel. If we have something standard which we can, make use of, let's try to use that. I mean, a lot of time it comes to, this is how we've been doing things, let's continue using that way. So healthcare is very, they do not like change. So we're trying to change that culture here. We've got some good progress, and we try to make it better.
Yeah, no, I hear you, Safi, and I absolutely can tell you that many organizations are on the same journey, and the journey is largely about how do we enable self-service, automation, delivery of insights to the right people in the right context at the right time, not just caregivers, physicians, care nurses. You look at all the different stakeholders and personas that are involved in delivery of care. There is the level of maturity that has to occur, and it looks like you're clearly on the path there. standardizing nomenclature and definitions and ways to look at and look at metrics and understand performance, building shared data models, focusing on enabling self-service and then delivery of those insights into an integrated experiences. It's really the journey that many are on, and it's great to see that you're on that as well. And lots of struggles along the way, which clearly, hopefully, a lot of our listeners today, feel connected to, because they're, I'm sure, as you are, going through very similar forces. So appreciate you taking the time today and sharing those insights. It's always great to hear from people who are doing the work at the ground floor. So thanks for joining us today.
Absolutely.
Yeah, it's great to hear, and I think that for those who work in a similar role as yours, it's helpful, right? They're not alone, but I think there is that maturity model or kind of the path that people are on, as Raheel described, where there's kind of where you're at, but having something aspirational, and it sounds like you're working on some great initiatives, Safi, to help get the organization aligned, establish that scorecard, better utilize the data resources you have. Of course, if you got new resources, you would figure out good ways to use them as well to support the needs of the organization. So thank you for joining us. That's all we have time for today, but we do appreciate your time. Next time, we're going to talk with Eric Dater from Catalyst by Wellstar about some of the innovation initiatives that they're working on there. So thanks, everybody, for tuning in. We'll see you next time on the Health Tech Edge.
Thank you.